program to talk about measures to mitigate tuberculosis and find a way to end tuberculosis in the country. We now have joining us on the program Dr. Ugochi Ajaero, who is an ART clinician at the AIDS Healthcare Foundation, Nigeria. Thank you so much, Doctor, for joining us on the program at this moment.
Thank you, Aisha, for having me.
Now, I just want, as a backgrounder, what exactly would you say is tuberculosis and how does it spread from one person to another?
Okay. All right. Thank you very much once again for having me on the program. So, tuberculosis is like a disease that is almost as old as man. So it was actually discovered in 1882 by Dr. Robert Koch. So sometimes it's called Koch's disease. Maybe just to, when we don't want to stigmatize people, sometimes it can be called Koch's disease. So it was actually discovered back then, and you see that it's a disease that affects everyone. It can affect everyone of different age groups, both children, even newborn, adults, pregnant women also. It can actually affect different classes of across all the age groups. So tuberculosis can actually be spread. It's an airborne disease, so it can be spread by air droplets. So what happens is when someone with tuberculosis has tuberculosis and maybe coughs in the air or even speak as we're speaking, if someone has tuberculosis, so another person who comes in prolonged contact. So there has to be prolonged contact with someone that has tuberculosis. So it can actually spread by maybe inhalation of the air droplets from the person who has tuberculosis. So that is the way tuberculosis is spread.
Okay, now, Doctor, I'd like to hear from you. What would you say are the early signs and symptoms of TB? And also, how can someone know if and when to get tested?
Okay. So the early signs of tuberculosis, we have the four cardinal signs of tuberculosis. We have cough for more than 2 weeks. But for more than 2 weeks is for the general population. So, we also have a specific population that tuberculosis can affect, which is people living with HIV. So we say in their case, any cough of any duration at all should be, and tuberculosis should actually be suspected. Then aside cough, then we have fever. Also, fever for a prolonged duration. We say we use Bengamp of 2 weeks, a fever of more than 2 weeks. Then also weight loss. So someone has been losing weight. You're gradually noticing that, you're losing weight. And then there's also drenching night sweats. So we explain it in such a way that when you sleep at night, it's almost as if you were poured water on. So that's drenching night sweats. Then we have other symptoms too, like coughing up of blood, the normal loss of appetite, weakness. So these are, classical signs of tuberculosis. But tuberculosis can actually affect any part of the body.
I was actually going to come there.
Exactly. Okay. Yes. So maybe let me.
No, go ahead, please.
All right. So tuberculosis can affect any part of the body. So you can have TB of the meninges, which can affect the brain, TB of the liver, TB of the uterus, any part of the body, even TB of the skin. So you see that when you have those ones, when a patient has any of those other tuberculosis, then the signs might also now be pointing to where exactly the patient's the TB is located.
I like the fact that you have stated clearly the different locations and parts of the body that tuberculosis could present. But I'd like for you to also bring us up to speed on the risk factors associated with tuberculosis.
Okay. So I think I mentioned one earlier. So I mentioned so normally tuberculosis affects so let me say two different populations. So people that are immunosuppressed and then people that are not immunosuppressed. So when I say people who are immunosuppressed, it means that maybe they have an underlying condition that is suppressing their immune system. TB thrives when the immune system is not adequate, is not optimum. So you have people that are immunosuppressed. So for example, people living with HIV, because of how the virus is, it can actually suppress, one's immune system. So allowing TB to grow and thrive. So that's one of the risk factors in fact, one of the risk factors of TB is living with HIV. Then another very important risk factor, in fact, sometimes even more than people living with HIV, is malnutrition. So people that are malnourished, so you see that there is a higher tendency of them coming down with tuberculosis. Then you also have people that are diabetic. So sometimes diabetes can also predispose someone to, come down with tuberculosis. Then other conditions such as, so let's say someone had a transplant, an organ transplant, maybe a kidney transplant. So because they will be placed on lifelong immunosuppressive medications, so they are also at risk of, coming down with TB. And also people that are living in enclosed places like the prisons, elderly homes. So because of the crowded nature of some of these places, they can also be predisposed to having tuberculosis.
Doctor, you have stated quite a number of risk factors here. I mean, for people who may not be aware, this is very vital that you have stated them out articulately like this. But then let us look at the country Nigeria. I'd like to hear from you. How serious is TB in Nigeria, and which group of people would you say are most at risk?
The burden of TB in Nigeria, it's so sometime maybe 2-3 years ago, Nigeria was 6th in the world with the highest burden of TB. So Nigeria is top 10. But we see that from 2023 to 2024, which is last year, Nigeria moved up to being number 3 in the countries with the highest burden. So they are second only to China and India. So we see that we have a lot to be done. But maybe this could be because more cases are being identified, right? So more cases are being identified and more people are being placed on life-saving medications. Actually, about 361,000 people came down with tuberculosis in 2023. So you see that every day, 268 people die of tuberculosis every day. So the burden in Nigeria, it's actually a lot.
That's quite the statistics.
Yes, that's quite big. And then you see that the burden is a lot, although, like I said, a lot of efforts is being put into identifying new cases and also placing people on life-saving medications. So the people at risk, we have children, especially those that are less than 5 years. And then you have elderly people over maybe 65 years and above. So because of the immune system also becoming weaker, they are more predisposed to having tuberculosis. Then pregnant women also. So pregnancy is a state of immunosuppression, right?
Right.
Exactly. So it can also predispose them to having tuberculosis. Then we have populations such as people living with HIV and then all the other risk factors that we also mentioned earlier. So these are the populations that are most at risk in Nigeria.
Thank you. You have stated quite a lot, and I'm sure that this is very valuable for people who may not be aware that these are the populations that are at risk for this particular disease that we hope to curb and mitigate, and as a matter of fact, end in Nigeria.
Yes.
But then, Doctor, I'd like to hear from you. Can TB completely be cured? Because it's not enough that we talk about the disease, the symptoms, risk factors, causes, or early signs and all that without looking at, treatment. I'd like to hear from you. Can it be completely cured? And what treatment options are available in Nigeria? I mean, the statistic is high.
Yes. So I'm happy that you asked that because this is one of the ways to actually improve awareness out there. Because a lot of people do not know that TB is 100% curable. Okay. So the treatment for TB, it's a disease that is completely curable. Just that it takes quite some time to cure TB because of the way the bacteria is. So you have to take medications for maybe a longer duration of time. So in Nigeria, or rather all over the world, TB is treated with some combination of medications. So we have different drugs, the first line medications, second line medications, and then even up to third line medications. So you see that for the first line, which is most people that come down with TB, so we start them on antibiotics. So because it's a bacteria, we use antibiotics for them. So we have medications, rifampicin, isoniazid, ethambutol, pyrazinamide. So these are used to treat the medication depending on they are used to treat the infection depending on the weight of the individual. So it's a combination of this medication to ensure that the disease is completely eradicated. So this treatment is done for about 4 to 6 months, after which at every step, we follow up the clients. Because before we say that somebody has been killed, we have to carry out some investigations to ensure that this person has been rid completely of the bacteria before you say the person has been cured of TB. If not, the person can also go out there and also add to, increasing the spread of the disease. So then, apart from the first line medications that I mentioned, so someone can be resistant to one of those first line medications, which will have to move the person to other medications such as second line and third line medications. So to answer the question again, yes, TB can be cured 100%.
Now, doctor, you stated quite the statistics earlier. You did say that Nigeria moved up to third in the world. I mean, third only to China and India, and that is quite a lot if we're being honest with ourselves. Because for Nigeria, with the number of population that we have, that means we're putting ourselves at risk if this is happening and we don't find a solution as soon as possible. And then 361,000 TB patients in 2023 is high, is really high. But doctor, I'd like to hear from you. You talked about the disease being curable, but what about preventive measures? Because I come to realize that for a lot of diseases, it's better we prevent before we start to treat. So prevention is always the key when we speak with health experts. But I want to pick your brain on this. What are the preventive measures?
Okay, so some of the preventive measures are, first of all, I think education is key, creating a lot of awareness on TB. Because it's only when you are even aware of, something you can prevent that you can make measures to actually prevent the disease. So we need to increase awareness, increase campaigns on, preventing, on educating the public on tuberculosis. Then also, if you happen to come around someone that has had cough for over 2 weeks or any of the symptoms we mentioned, then use of face mask. So even the person who has been diagnosed of TB, we should ensure that the person uses the face mask. So in fact, one of the ways that we treat people, we advise them to isolate themselves. Okay, so like I said, before someone can be completely cured, we do series of investigations to ensure that the person does not also spread the bacteria. So we advise that they isolate themselves, maybe at home, because in fact, the treatment of TB before used to be a directly observed treatments where you live in-house with the medical professionals and then they treat the TB. So you are there, you don't have exposure to other people and all that. But right now we advise and we encourage that they isolate themselves best at home. And then if they have people around them, they advise that they use face mask, the use of face mask. Then in homes, we ensure cross ventilations. Like this office, we ensure that we have cross ventilation across the office. Then also there is a medication which we actually use to prevent tuberculosis. It's called tuberculosis preventive therapy. There are medications actually. So if we have someone that has come in contact with someone that has TB, so we ensure that the person doesn't have TB, then we place the person on that medication to ensure that the person doesn't contact the bacteria. And also the other populations I mentioned that are at risk, so we also place them on those medications to ensure that they do not contact tuberculosis.
Doctor, what role does vaccination play in preventing tuberculosis?
So at the moment, just like every other disease, vaccination plays a huge role in preventing tuberculosis. So the vaccination which is given, we know the BCG vaccination, which is given as children, which is given to children, and can also be given to some of the populations we mentioned. But tuberculosis has so many forms. Like we said, we have the pulmonary tuberculosis and the extrapulmonary tuberculosis. So the vaccine only prevents from it only prevents severe forms of tuberculosis. So you see that some people can still come down with tuberculosis even if their immune system gets compromised. So vaccination, yes, it plays a huge role, but some people can still come down with tuberculosis if their immune system has been compromised. But we advise that everyone takes the vaccine because it prevents from severe forms of tuberculosis.
So the vaccines are only available for children?
No, the vaccine are not only available, but most times because it's also incorporated into the national the vaccine schedule, most people take it as children.
Okay. Um, you talked about how vaccines are mostly for serious and more complicated cases of tuberculosis. So, what then happens for people who do not present with the serious forms of tuberculosis, but then they have been vaccinated and they are still at risk of coming down with full-fledged tuberculosis? What happens to those group of people?
So those group of people, we end up treating them. So the way TB works is that, so there's something we call latent tuberculosis. So latent tuberculosis is, in fact, about 1/4 of the world's population has inhaled TB at some point. So you will see that the infection is different from the disease. So someone can inhale tuberculosis, but you mustn't come down with the disease. So only about 5 to 10% of people actually come down with the disease. So you see that most times the 5 to 10% the 5 to 10 percentage of people that actually come down with the disease, probably they are, like we mentioned earlier, maybe immunosuppressed, or they just came down with the disease. So sometimes even after taking the vaccine, someone can still come down with the disease. So what we do when we get someone like that, we don't really start tracing if they had the vaccine or not. We just ensure that we treat the person, ensure that the person is free of tuberculosis, and also prevent their loved ones from also coming down with tuberculosis, and thereby also protecting the community.
Dr. Ugochi, you have talked about treatment, so keenly, but I'd like to hear from you how readily available, accessible, and affordable these treatment options in our healthcare system in Nigeria today. We're looking at the rural community and even the urban centers.
Okay, so in Nigeria today, the medication, the treatment for TB, let me start with that, is completely free. So you can walk into almost any government facility, such as government general hospitals, federal medical centers. Most of them are dot centers that can actually offer treatments for tuberculosis. So the medications are readily available. So in rural communities, at least I should think that some they have some foot soldiers that go around and check, even sometimes house to house, to check for people that have tuberculosis. They can ask for symptoms like we discussed. So if they find anyone positive, then they can collect samples from the person and then take it to any of the general hospitals, any of the hospitals or TB centers to test. And once that person is diagnosed, then they take the full centers take up treatment from there. So you see that in Nigeria, we have so many centers where you can actually access TB treatment for free, and it's completely free. So in Nigeria, the medications are readily available, and the centers are also readily available.
Okay, doctor. During your line of, during the course of your profession, and I'm sure you have met with a lot of patients, I'd like to hear from you. What would you say are the challenges that these patients face, and how do you think they can mitigate them? Towards curbing TB.
Okay, so some of the challenges, so having interacted with quite a number of them, so I would say some of the challenges are stigma and discrimination. So yes, so just like most other, infectious diseases, TB is one of the diseases that people are stigmatized for having. So you see that people are worried about, if I come forth, if I have these symptoms and I come up and, and I get tested and I'm positive for tuberculosis, you see that people are worried about other people finding out that they are TB positive. So the stigma and discrimination is a huge challenge to, making diagnosis of tuberculosis. Then also the financial constraints. So maybe not in case of in terms of medications, but in terms of feeding and in terms of transportation to the center. So imagine if maybe someone is in a rural place and then the next place where they can access TB medication is like some kilometers apart, especially with the current economic situations in the country. You see that the burden of transportation is actually quite a lot because you have to visit these facilities not not once. You have to keep going there so that to ensure that you are completely cured. So the financial constraints are there. Then another thing is the duration of treatment. So like we mentioned earlier, this treatment can take up to 6 weeks. And then if it's a resistant strain, sometimes it can take up to 24 months, which is 2 years. So you see that that long duration of treatment is a huge challenge to, many patients. So I think these are some of the challenges that patients face.
Okay, but how can we walk around these challenges just so that we achieve our goal?
So I would say the government has to come in, especially in terms of financial constraints. You see that if maybe people are more economically stable,
Right.
yes, they will be able to maybe handle some of these medications and be able to afford food and then the transportation also for to go to these facilities. Then in terms of stigma and discrimination, more awareness needs to be created so that people will know that this disease is a disease that can be completely cured. Okay. So it's a disease that once you come down with it and you take the medications, you adhere to the medications as prescribed, you can be completely cured of tuberculosis. So, like we said, awareness also, you see that a lot of rural places are not really, they are maybe misinformed or even uninformed about tuberculosis, the symptoms, the signs. So if we can improve awareness in some rural areas and even um, urban areas, you see that we can mitigate some of the challenges of treatments of tuberculosis, and then also improving laboratories that make this diagnosis, because it's only when you are able to diagnose it that you can treat them. So improving laboratories, and then when I say improving the number, so scaling up the number of laboratories across the country that can make this diagnosis, then also improving on the treatment. I know the government has tried in providing free treatments, but we can also improve so that we can treat more cases of tuberculosis.
So what about capacity building for healthcare providers? And also, you would agree with me that the human resource for health is really low. A lot of doctors are traveling. I mean, according to statistics, there is the exodus of some medical professionals. Although just recently, we're also hearing reports that we have more medical people are coming also to Nigeria to access some of the healthcare services that we have here. But I just want us to strike a balance. What's your take on capacity building for healthcare providers and also provision of human resource for health?
Yes, thank you, Aisha. Very vital. I think it's very crucial. Yes, because not all healthcare workers have this information of treating tuberculosis. Not all. And when we need to improve the knowledge of healthcare workers in terms of treating tuberculosis, the medications, recognizing the signs, the laboratory services to request for. So we need to increase awareness, build capacity of healthcare workers in rural environments, healthcare workers in urban environments. We need to actually build their capacity. And then in terms of the brain drain, we also need to try and make doctors. I think I think I saw a study that was carried out, and one of the striking things about the brain drain is because of financial compensation. So the government can try to increase the remuneration of doctors to enable them find some form of satisfaction in the job that they do. I believe that maybe a lot of doctors will not leave as much as is happening right now.
Mm. Thank you so much, Dr. Ugochi Ajaero. Thank you so much for sharing this valuable insights and also, I mean, your time with us on the program today. Thank you.
You're welcome.
Now, it's evident that commitment to ensuring that we end tuberculosis in Nigeria today is something that is multifaceted, and it involves all stakeholders. I mean, all hands must be on deck, from the patients to the government to the healthcare providers and every other person within the health sector, just so we end tuberculosis in Nigeria. It is a must. We must end the fight against tuberculosis, and we must, put our resources together and all of our efforts together, just so tuberculosis ends in Nigeria and the statistics come down. And that's about the size of our package for you on Healthy Living on Trust TV for this particular episode. Do not forget, you can always reach out to us, follow us across all of our social media platforms for comments, contributions, and suggestions on the program. Until next time, I am Aisha Saliu.